So welcome everyone. My name is Laura Gadenik. I'm the program coordinator for TICN, and I'll be facilitating today's presentation. Just a little bit about TICN. We're a nonprofit, and we used to have monthly presentations. I think we'll be getting back to that starting this month. Hopefully, we kind of took a hiatus for a little bit, but we do monthly presentations on various trauma-informed modalities, and the goal is to really educate the community at large about trauma and trauma-informed care, and really shifting the conversation from what's wrong with you to what happened to you. And so we do that, and then we also will be starting to do regular monthly newsletters as well to spread awareness about various events going on in the community and ways to take action in legislature as well. So that's a little bit about us. I forgot to say a little bit more about me. I have a bachelor's degree in psychology, and I'm going to the University of Utah for the MSW program in the fall. So I'm really excited about that. And then, so I wanted to say about CEUs. If you're here for a CEU, if you could email me, I'm going to put my email in the chat, and then you can email me if you're wanting a CEU, and I will get that to you probably tomorrow. Okay, and I'm going to introduce our speakers, Kristan and Lisa. So while I read this, Kristan, if you could watch I don't know if you're able to watch if people are trying to get into the presentation. Okay. So Kristan Warnick co-founded the Trauma Informed Care Network of Utah in 2013 to facilitate networking and education between trauma-informed mental health caregivers and the community. In 2017, Trauma Informed Care Network was established as a formal nonprofit organization, and she currently sits on its executive board. She is also a member of the Trauma Resiliency Collaborative, another Utah trauma-informed initiative group. She currently serves as an appointee to the Utah State Advisory Board on Children's Justice and Children's Justice Act Task Force. Kristan is also a clinical mental health counselor and founder of Healing Pathways Therapy Center, a trauma and attachment-focused counseling center with locations in Mill Creek and Provo, Utah. Previous to founding her private counseling practice, Kristan spent 13 years working as a school psychologist in public schools in Utah and Alaska. She also served on the faculty at Brigham Young University in the Counseling Psychology and Special Education Department. Kristan received her BS in psychology in 1994 and MS in school psychology in 1997 from BYU. She grew up in the Seattle area and currently enjoys spending time at home, being in the outdoors, traveling, and recreating with her son and husband. She's passionate about and appreciates opportunities to connect, network, and educate on issues surrounding trauma awareness and trauma treatment. Dr. Lisa Gold is the founder and director of training for the Arizona Relationship Institute. She is a certified emotionally focused therapist and supervisor, and AASECT certified sex therapist, providing integrated treatment for healing trauma, sexuality, and relationships. I'm not sure what that acronym stands for, so maybe she can elaborate. Dr. Gold has developed a highly effective model for ketamine assisted therapy, integrating EFT, internal family systems, somatic experiencing, hypnotherapy, breathwork, and music. She trains other therapists in this model and provides Concierge customized integrated retreats, including ketamine assisted psychotherapy to individuals, couples, families with adult children, and families of choice. So with that, I think we are ready to get started. Unless I missed anything.
Oh, thank you, Laura.
That was great, Laura. Thank you. We appreciate that. And it's great to see some familiar names. I'm not seeing many faces, but some familiar names. Feel free to put your video on if you want to be seen, and some new people. So we're excited to have you all here and excited to talk about this topic. So we only have 11 slides, so we'd like this to be kind of an open discussion and bring up questions. Laura will be kind of monitoring the chat. So if you have questions throughout the presentation, we can address some of those, and then we'll hopefully be able to leave plenty of time at the end for more discussion, because we know this is a really compelling topic right now. So we'd love to hear your thoughts and questions. So we appreciate Laura's introduction, and I gotta figure out how to make my thing change to the next page. There we go. Actually, I'll stay here for a minute. So just to tell you a little bit more about ourselves in the psychedelic assisted therapy journey, Lisa is a great friend and colleague who I've known for a long time, and she's always 2 steps ahead of me in the field. And she always says, Kristan, you need to try this new great thing. So a few years ago, she reached out to me when she started doing ketamine assisted therapy. And so that was really a catalyst for me to start studying it, start wrapping my head around it, as I'm sure many of us are doing, and then to be able to do some trainings and start doing some kind of basic work with ketamine clients. So I kind of represent the beginner in this field, and so can share that beginner's perspective and some things that we can think of as we're just kind of dipping our toes into and doing this kind of work. And then Lisa will share in a minute her experience, that she's really been able to do some cutting edge things and start out kind of, you know, a few years ago in this field, and have some great extensive experience in this. So I'll let her talk about that for a minute.
Well, thank you. I always love when I can do some work with Kristan. Like, this is always so fun. I adore her, respect her so much too as a professional. But yeah, I was interested in ketamine because a good friend of mine actually owns Reset here in Utah. And he knew that I did EMDR therapy and emotionally focused therapy. And it was actually his idea. He said, what do you think about pairing EMDR and EFT with ketamine? And I had really no frame of reference, except for that I had some clients that had participated in ketamine therapy, but without any guiding whatsoever. And actually, one of my friends and colleagues, a therapist in Arizona, she had said that one of her friends had done a ketamine assisted therapy and that she had attended with her. And she said, you know, the thing that was the most impactful was, she said it was incredible. And the thing that was the best, though, was being there together. And, you know, my friend attended as support for her friend. And she said how the relationship and her friend knowing that she was there as a support, and the way that it facilitated just an openness between the two of them was really part of the magic. So those, you know, that feedback from these friends and the encouragement from Todd Pepper that owns Reset really got me thinking, getting curious. And I think my creativity is one of my greatest strengths, and my willingness to think outside the box. And so my clients were willing to allow me to experiment with introducing ketamine as one of the interventions, as part of the larger whole of the therapy that we were engaging in, and using it to facilitate corrective experiences. Those of you familiar with EMDR or EFT, that's really what it is all about. It's doing the preparation, facilitating a corrective experience, and then integrating that experience and reinforcing access to new ways of thinking and feeling and being with one another. You know, the interaction piece is very important as well. So they allowed me to videotape our sessions, and I followed Sue Johnson's model in terms of how she developed emotionally focused therapy, which is she was looking at her work to see where the key moments of change were and noting the interventions that were the most helpful. And so that is the way that the model that I've developed evolved, was out of those experiences over the last 2 years. I was fortunate that really most of my clients were really open to experimenting with me in this. And Also very fortunate that we had excellent outcomes. It far exceeded my expectations. People that I truly did not know what else to do to help them when we did the ketamine. You know, usually I actually have a lot of therapists that are working with clients because they aren't knowing what, they hit a wall and they're like, you know, I don't know what else to do to help them. And I'm usually able to help them with EMDR and EFT and kind of the blend I do the two of those. But there's definitely people that I'm sure you can relate. You see them working so hard and I'm working so hard and they're not making the gain in proportion to their effort. And I always had tremendous compassion for them and was wishing I had, you know, the magic wand. Times we said to clients, right? Or at least it. And I do feel like ketamine is that magic wand. It is something that helps tap into the neurobiology in a way that the other, you know, just our models alone, as good as they can be, there are people that have some neurobiological constraints and are really needing help for their brain to access greater neuroplasticity. So I'm so incredibly grateful for this as an option and to be able to see people make progress in proportion to their effort. So I'm excited to be able to share this with you. And there's definitely different levels and, you know, degrees that you can to use this. You already have things that you are doing that are effective with your clients. I want to encourage you to consider the possibility of, you know, exploring ketamine as an intervention that you would use as part of the larger context of your therapy, you know, part of the treatment plan. I just yesterday did a ketamine treatment with an ER physician, and he said, he looked at me, you know, it was remote, Zoom, and he looks at me in the camera and he's just like overwhelmed with gratitude. He just is like, thank you, thank you, thank you. I can beyond grateful that you're doing this for me. And he said, it scares the hell out of me to think that people are going through this without guiding. Because when people, especially, you think about the population in general that we're recommending do this are people who they're not making the gains that we would like to see with, you know, the therapies that we're doing. And so they have a lot of trauma. And if they really aren't prepared and they really don't have someone helping them and guiding them through, then it can actually become a traumatizing experience for them. And it reinforced to me yesterday that feedback from that client. So I'm grateful that you all are, you know, willing to come and learn how you might be able to incorporate ketamine as part of the larger whole of your treatment plan.
So thanks, Lisa. We're going to just start with a quick video. I think it's just about 90 seconds of an example of a client who's gone through the ketamine experience, so you can hear from the client's perspective, and then we'll talk about it.
My name is Nicole Winkler. I've been living with depression for about 20-something years. Depression affected my life on every level. I had a hard time getting up out of bed. I had a difficult time doing anything that I enjoyed. I would be a complete jerk in social settings for absolutely no reason because I was in a bad place myself. You live with this dark cloud over your head and you don't know why. I had tried SSRIs and mood stabilizers when I was about 19. So I knew I didn't want to go down that road again because I didn't like the way they made me feel. I found out about ketamine through a Google search. I clicked on the link, I sent an email, and I got a response almost immediately. And that was something that really caught me off guard too, was talking to a doctor directly. And we had about a 10-minute conversation and it just felt right. The way I felt before my first ketamine treatment, I was super nervous. It was something completely unheard of. Honestly, I was at my wit's end. So I wanted to try anything to make me feel better. I would recommend ketamine to anybody who feels the way I was feeling. I think that this is an amazing treatment, and I think it should be more widely known and accepted. My life since treatment has been amazing. I've been able to handle stress like what I feel like is like a normal person. The weight of the world isn't as heavy.
So, oh, sorry. Where'd my Continue.
My name is Nicole Winkler. I've been living with depression for about 20 something years.
Sorry, everyone. I'll find my presentation. While we're doing that, I would love to hear any thoughts or comments people have so far. I know some of you have probably already had some experience in this, and maybe this is brand new for some of you. So we'd love to take just a couple comments just as you're learning about ketamine or psychedelic assisted therapy, or based on this movie. What are your thoughts? Okay, and we can get to more thoughts later if we don't have any yet. So any comments on that?
No, I think it's really well done. I like that you have that presentation.
Yeah. So, and as we're doing this, a lot of us, especially as new, oh, go ahead.
Sorry, hopefully this is, appropriate. Feel free to not answer, but when you guys were discussing your backgrounds and your sort of experience getting into the treatment, I'm just curious if either of you have received the treatment yourself, just to sort of know what that process is like on the other end. I know as clinicians that we're often encouraged to be in therapy and counseling ourselves to know what it's like on the other side. And I was kind of curious if that connects to this treatment.
Absolutely. I know, both of us have, and actually I'm in the process of getting a certification as a psychedelic psychotherapist through the Integrative Psychiatric Institute. And their stance is actually that you have to be experiencing it. Part of the program is you have to experience them facilitating a guided treatment for you so that you can know what your clients are going through. Like you've, I'm sure, heard before, you can't take a client anywhere you haven't gone before. And that definitely applies with ketamine. Truthfully, a lot of what I have developed in my model of how I practice it was born out of my own experience of what was helpful, not just in watching my clients and interacting with them, but also of what it was like for me as a patient, to experience it. So I would strongly encourage that if you're going to do this work, that you also do experience that as well for yourself.
Yeah, and one thing we want to underline with this presentation is this is really an introduction. A lot of us will have clients that choose to go through a psychedelic experience, whether legal or underground. And so whether we've done that or not, that's one of the purposes of this presentation, is to really understand and support and even make it okay for our clients to talk about the experiences that we're having. And we don't have to be experts to do that, nor do you necessarily have to have experienced ketamine, although, as Lisa says, having that experience and having clients with anxiety about it, which is understandable, say, have you tried this? It can be very reassuring to clients, just that you've, these experiences are something that are very hard to describe unless you've kind of done it yourself. So it can be a big advantage. Even there's several practitioners around here that work with professionals and help facilitate professionals having the experience, even if you don't have a big topic you want to work on, stress management or whatever. So again, you can certainly support clients and probably even do some in-depth work without doing it, but it is highly encouraged. So any other thoughts or questions?
I really liked Lisa's comment about tapping into the neurobiology, and I have some clients where they just have so much like physical pain and a trauma load and things like that, that when we try to do some neurofeedback with them, we're running into like sympathetic nervous system responses when we try to calm them down, or we're running into other issues where it's just hard. And so I'm wondering if those kinds of clients would be a good fit for ketamine, where maybe they could help resolve some of the trauma, and then we could work on stabilizing and calming and things.
I would say 100% yes, because in this training that I'm participating in as a student, they we had some of the top researchers that are looking at the brain and what the effects are when it's on, you're experiencing ketamine. And next time we do this, it's just super quick, so we didn't have a chance to add the slide, but it's really amazing to see these images. And what happens is, when they're doing images of the brain, usually like they'll show images to somebody and like the certain areas of the brain will light up. Well, when someone is experiencing ketamine, their whole brain is lit up. And another thing that's fascinating is that the regions have, the margins are less rigid. There's more of a blending. There's an interaction going on with all parts of the brain and between the different parts of the brain. So think in terms of, like I integrate internal family systems in what I'm doing, and internal family systems and transpersonal psychology. Those are two models that a lot of work is being done on. But you think about this, when we talk about parts, those parts really do correspond to different neural networks, within our brain, and that those triggers that we have, when we're having a trigger, different parts are going to light up. But you think of with EMDR and IFS, you're trying to access the parts that are in pain and help create a bridge to the parts that are resilient, and to help the resilient parts be the lead, the guide for addressing the threat that is being perceived. And we want those, our painful emotions and the trauma response to be transformed into messengers rather than the ones that are running the show. We want to have, like Don Siegel talks about, Marshall Linehan about, a wise mind. We want to have a full integration, and we want flexible structure within our brain. Well, ketamine facilitates that on a neurobiological level. And it really is scaffolding to allow the brain to do what really some brains can't do without that kind of support. And, I'm just so delighted with this because there's so many, I've supervised other therapists and trained them in emotionally focused therapy and just as towards their marriage and family therapy license for since 2003. And inevitably, it's normal for us as therapists to get irritated and frustrated when we can't help our clients. And it can be, a very human response to go to blaming the client, to saying, oh, well, they're just not trying, or they just want to stay where they are and stay unhappy. Personally, I don't believe that. I believe people, they continue to have a grip on habits that to us we look at and we think, why are they doing this? They just must not want to get better. It's that they don't have access to anything else. And it's a much more compassionate stance to recognize that, and to recognize that, yes, it's frustrating and hard when we're working so hard and we're not being able to help our clients in making movement. But I've had clients that were so challenging and had them try ketamine, and I have a client that was severely what you would diagnose as a severe borderline personality disorder. And ketamine has made me rethink a lot of the diagnoses that we give to people. And really, I'm believing more and more, and this is how actually the program that I'm in at the Psychedelic Assisted Therapy program, they are saying that really our diagnoses, we need to let go of the rigidity of how we are pigeonholing people and see it as you have a problem with either being overregulated or underregulated in terms of your central nervous system, and that there's varying degrees of access to, an ability to find that center, find that calm, find that parasympathetic state. There's varying degrees that people have access to, and we need to start looking at it as from that framework, and be building in resilience of them being able to consciously access their parasympathetic state. And that is what ketamine actually does help people to do, is they can start to implement the research we're working with them on, and it actually will work. We have to realize people are not all, just like with anything else, we don't all get the same set of, the degrees of challenges or gifts. And some people need more neurobiological support.
Great. Thank you. Great questions. We'll keep moving, but feel free to put those questions in the chat and we'll keep addressing them as they come up. So thanks, Lisa.
Sure.
So like I said, I'm kind of the beginner's mind in this, so I'm going to be the bullet point girl.
My name's Nicole Winkler. I've been living.
Trying to advance to
There
the
you go.
next
You got it.
slide, and there we go. Okay, phew. Always makes me nervous when my tech doesn't work. So I'll kind of be the bullet point girl, and then I'll let Lisa kind of follow up and elaborate on things. So we wanted to throw in benefits and contraindications, and research and qualitative experiences are showing that we're getting good outcomes for treatment-resistant depression, anxiety, suicidality. That's kind of where we see the most dramatic results, sometimes with those more extreme cases, but it can definitely help with more subtle cases as well. And we've seen lots of good trauma processing happening. You get the medical benefit, meaning no matter what happens during the trip, you get a neuronal benefit and you get a neuroplasticity benefit, and kind of that boost and reset that we hear about with these drugs. But then the experiential benefit can be so powerful. What comes up during the session, what themes, what traumas, what resources, and we'll talk a little bit about that later, so we can benefit in both ways from these treatments. And we've seen it help people who are just kind of really stuck in a rut. Ketamine is kind of like erasing the frozen tracks in the snow, like the snowplow comes through and kind of erases those tracks, so people can kind of have fresh powder, for those of you who are skiers in the group. So that reset and kind of new possibilities and new direction can be really great for people. It's definitely being used for performance enhancement and peak experiences. A lot of this was coming out of the San Francisco area. People, tech people, and a lot of intellectuals and people with money were doing a lot of this work up front. So there's some of that going on. There's great outcomes with hospice, end of life, terminal illnesses, people who have a lot of fear about those things. This can really help bring them a sense of peace. And then some really good outcomes with addictions. And some interesting research about how different psychedelics are helping with different addictions to different substances. So some really cool things. As far as contraindications, it's not right now recommended for people with severely psychotic tendencies that can kind of exacerbate some of those issues sometimes, or those people can be extra vulnerable. It's important to screen for medical trauma. If anyone has any bad experiences with needles or IVs or injections, that's really good to know up front as you're trying to design a positive experience, or help, supporting your client as they're working to design that experience with their medical providers. And then the last category for contraindications is cardiac conditions, high blood pressure, and seizures are contraindicated. So I'll let Lisa add to that.
Actually, I was wondering if anyone had questions about this, because it's pretty straightforward in the bullet points, but if anyone had any particular questions about any of these bullet points.
There's a question in the chat. Lynette asks, how do people with, okay, I'm not sure what DID stands for. How do people with DID do with ketamine? Do you know what that stands for?
Yeah, dissociative identity disorder.
Okay.
One of the things, this program that I'm in, I'm like all excited about it, because they had like Richard Schwartz, Pat Ogden, they're present, and we get to ask them questions, and it's just been phenomenal. But he actually was saying this week that we really need to look at DID patients and realize that really they are similar to everyone else, in that we all have parts. It's just that theirs have not been as integrated. They haven't had as much awareness of and ability to access their parts. And so if we can understand, you would definitely want to know all of those parts. You would definitely want to be processing and having respect for each of the parts, and actually making sure that each of the parts are enthusiastically consenting, just the way that you would with anyone who doesn't have DID. But you would want to attune to and be respectful of all of the parts and create that safety for them, so that they would be on board, and have kind of, in ketamine, in a way, you're like having these contingency plans of being aware of the trauma that may arise, And some of the trauma, if you're specifically targeting it, like with EMDR, you are going to consciously, actively activate it as a means of reprocessing and rerouting it to the resilience. So with the DID client, it's going to be as if you're working with an entire family and be attuned to each of those parts, aware of the possible trauma activation that might come up, and or specific traumas you're wanting to activate so that you can rewrite. You can, I love the analogy of the skiing, that it's like you want some fresh powder instead of those grooves and the moguls that had been formed over years. So it is really definitely something to be used with DID clients, but not unless you feel confident in working with DID clients in general. And I would say that goes in general for any diagnoses with which your clients are working. If you don't feel confident in being able to help them navigate certain aspects of their lives, without ketamine, then that would be something to not take them into in ketamine, and to, get some other supervision and support around that in helping them with it.
Yeah, and that said, I have worked with a therapist who shared some of the experiences of her DID clients with ketamine, that she was able to go support them and having really neat experiences where the parts actually maybe met for the first time, got everyone together for the first time. I've had a client I've worked with, for some reason I've been forgetting the name of it, a step down from DID. It's one of the other dissociative disorders where she's aware of all her parts. Mm-hmm. She has kind of distinct neural networks, but she's always been aware of them. And her parts really came out in her ketamine experience, some real positive parts and wise parts that we've been able to really resource. So yeah, I like how Lisa put that if you're feeling pretty competent in the level of diagnoses, that especially with some training, you could mm-hmm. probably support some really positive experiences when those clients are ready. So
definitely.
Any more questions on this slide before we move on?
Carrie Scott is asking if there is an age restriction.
That's an excellent question. I wondered that myself. I don't know. I believe because it's still really in its infancy in terms of the research, usually they're researching on adults. I haven't seen any research that's been done on adolescents or children. I've been combing all the research actually recently, and I haven't found anything that's about adolescents or children. So I can't say that it's not being done, but I haven't seen it in the research.
I do know that our local clinics are working with teens. I think even Reset has talked about teens. So, checking with medical providers, not that they're always doing everything we might agree with, but some of those questions are really good for the medical providers or clinics that you might connect with, and what they're comfortable with and what their experience has been. So
great point.
Okay. Any other?
Go ahead. Lauren Camp is asking, is there a contraindication with bipolar or mood disorder, or does it help with the swings of the highs and lows?
What's fascinating is it actually, not only is it not contraindicated, is that there's one of the directors of this program, he actually was super open about the fact that he was diagnosed with bipolar and that it's been through ketamine treatment. He does not have his symptoms anymore. So yeah, it's pretty fascinating.
Cool. And then let's see. Okay, there's also some comments. I'll do another question though. Maybe you all will get to this later, but I'm wondering if you have a preferred route of administration and what you see as the difference in experiences between routes. And that's from Kate Kincaid. I think I said her name right.
Let's address it now, because that isn't in our slides. So I'll have Lisa talk about that.
Well, I think, it's interesting because more and more places are really doing just the intramuscular. My initial experiences at my clinic, we had only done the IVs, and I liked the IV for at least the first one because it gives my clients at least have had a sense of safety knowing that they could stop the IV at any time, especially when they don't know what they're expecting. You know, the unknown is scary. To know that they have some measure of control, that if they don't like what they're experiencing, you can stop an IV right away. And if it's something that I like being able to titrate based on what the client's experience is, because even though there's the weight recommendations, there's still a range within those weight recommendations regarding you know, how deep or how light you could take someone. And everyone is so different in the way that they metabolize. You know, I've had some clients that they needed something super light to get the same result that someone else would need a little bit more within that range, right, of what's going to still be therapeutic. And it doesn't mean that you have to do it that way. One thing that they're doing at Healing Pathways is they're doing the intramuscular. They're starting it at the low, and then they will give them a booster, like, and augment it if they're needing more. So that is perfectly acceptable, and actually the route that most therapy agencies are going. But you know, it's one thing I've been doing now, because I am working with Healing Pathways, also with some other ketamine clinics though that do the IV. I'm giving my clients the choice. I'm letting them know there's options. And then I actually, from my own experience, I know everyone has been different, and just kind of, you know, speaking with people about their experience of the lozenges or the nasal spray. For me, the intramuscular and the IV are the same, and they really can help you to, you know, like take that fear center offline, take you into that melty, deep feeling of taking the tension out of the body. The lozenges, now I'm someone that just doesn't metabolize things very well orally, and so it's more tricky to get the dose right. And it's one thing with the lozenges that I've seen, or I have tried having it be the lozenge as like the first time somebody's experienced it. It's interesting, because I think sometimes you risk, if it's the first experience someone's had with ketamine and they haven't gone through those first 6 sessions, the risk is, in my experience anecdotally, is that you know, with this one client, I couldn't take them deep enough with the oral, and their anxiety was so big that it was like overriding their and then they started getting afraid about the fact that the ketamine wasn't taking them deep enough, and what did that mean about them, and maybe their anxiety is too big for ketamine to handle. And it's I personally think you should do the first 6 with either intramuscular or IV, and then after that, after people have already had that initial kind of loading dose, if you will, to reset the brain, the maintenance doses, I think that then the lozenges can be a very nice option. But to have the initial resetting of the brain, that fresh powder, that I feel, and again, this is what the majority of the work is being done with the IV and the intramuscular. There are some companies that are doing, in agencies that are using the lozenges in their clinics, but after having that one experience, I'm like, why would you risk it? Why not take them more, you know, take them deep in a way that you are just better able to see how people metabolize, because we don't know how people are going to metabolize orally, you know. And same thing with the nasal spray. Some people say that the nasal spray is better for depression, but not as good for that body relaxation. Other people say that they experience, you know, with the lozenge and the nasal spray, that it's just as good for them as the IV or the intramuscular. So again, I give people an option if they want at least their first one to be an IV. If they don't really care either way, then we can just go intramuscular. It's usually less expensive. It's less invasive. You know, having a needle in your arm through a treatment, it's no fun for anybody really. Mm-hmm. So if they don't care one way or the other, I would say, you know, go intramuscular.
And we'll talk through some of the slides about some of the different protocols. I saw Claire Julian's question, you know, how many treatments are typically needed? And we'll kind of move into this now and talk about the process. What's typically being recommended, as you can see on the first bullet point, is 6 sessions. And that's usually done over a space, ideally over 2 to 3 weeks. You know, so people, you know, often are taking half a day off work or taking a day off. That's something important to help your clients understand, you know, that you're kind of going to be out of it for a few hours and then shouldn't drive probably the rest of the day. So there's some logistical things to consider. In our references, we have a little booklet that's a really great booklet. I think you can pull it up on Amazon.
I think so.
And so you'll get a lot. You can read that booklet and get a lot of the kind of basic details that they would give a new patient starting ketamine. So us having a basic understanding, even if we're not formally trained ketamine assisted therapists, to just kind of understand it and be able to talk in an educated way about what ketamine is for clients who might be curious, and be able to kind of support them in making that decision if it's something that they're considering. If you're going to do any formal work with them during that process, it's good for you or your clinic to have a ketamine informed consent form. And always important to discuss your level of training competence and how much involvement you would like to have with the client, because we have a huge range, not only in our level of training and experience, but let alone our styles. You know, my style is very different from Lisa's style, just based on who we are and our preferences. So making sure they understand how you could or how they might want to have you involved is important. And then, you know, supporting the scheduling with medical providers. We're lucky to have a doctor in our office doing it. And we also know some good clinics, you know, in our area. And that's a good thing to do, is to kind of familiarize yourself with local providers and kind of understand the different flavors. There's a wide variety there too. We have everything from the guy who has bean bags in a lounge area to people who have a very medical, you know, very medical formal process. So it's good to know those different providers.
I could add on to that. One
Yeah.
thing to be aware of is you don't want to go to a clinic that is rushing you in and out with just an hour. You want to be somewhere where they give you some time at the end for the people to come out of it and process kind of what came up and integrate that a bit. So if they're like, they give you an hour and that's all, and they rush people out, that's not a good fit.
And we'll talk, Lisa said at the very beginning that our strong opinion, and many professionals in this field have a strong opinion, that this really shouldn't be done without the support and guidance of a therapist, at least a therapist, whether trained or not. We highly recommend that someone is working with a therapist who knows them, who understands their issues, who can kind of keep an eye on them during their 2 to 3 week process. You know, look out for any red flags or danger signs, let alone if you're going to do some processing type work with them. So, and that's the next bullet point, is depending on how much you're going to do. And honestly, again, even if you have no training, and when I say no training, anyone who's a therapist, first of all, you have training about how to support people in many kinds of experiences, let alone if you're a trauma trained therapist. A lot of the things to consider are very similar to the trauma work that we do, and that we don't know what's going to come up. We need to respect what comes up. We can work with the material that comes up, whether positive or negative. So, you know, being able to schedule appointments, like, when are your ketamine treatments, and do you want me to follow up the day after? Do you know, are you good doing 2 treatments and then I'll see you on Monday? So really kind of talking to your client so that they have you as a support while they're going through that treatment. And then it's always important to help your clients consider who's going to bring them to sessions, who might sit in with a session, whether it's you, if some of you are comfortable or interested in doing that. And ideally, they have someone safe and trusted. We know that set and setting are so important for psychedelic experiences. So if someone brings someone they don't feel safe with, or someone forces their way in the room and that wasn't what the client wanted, it's really important them to think about what is going to make them feel safe and have the best possible experience. We'll talk in a more detailed way about that, some other things we can do to make it a positive experience. But yeah, even who's driving you there, who's going to sit there with you is important.
Right.
So
I know, I totally agree.
okay, just throw any questions on the chat. We'll kind of zoom through the next few slides, but we'll watch for questions, and then we'll have plenty of time at the end, hopefully, to also get more questions. So like I said before, client-centered focus, like most of the good work we do, is so important in a psychedelic assisted therapy experience, or even just the medical experience, that people have a lot of say in how that goes, that they can decide if they want earphones, they can pick music if they have a preference. Most clinics have music that they can provide, or just pull up a relaxing YouTube channel, but there's a lot of work that can be done to customize playlists. You know, do they want a blanket? Do they want a weighted blanket? I had a client who really just wanted white noise. She didn't want any music. And repeatedly emphasizing to your clients that it's their experience. In some traditions, this is like a once in a lifetime experience. In some of the indigenous, you know, cultures who've done this, this is like something people have prepared for years. And so this really should be, you know, we want to optimize this experience and make it as positive as we can. And not to say there won't be hard parts or negative material won't come up, and we can prepare our clients for that, but we want to make sure that what we're doing is helping them feel safe and supported, and they have a lot of voice and choice in how these things go. Let's see, did I miss anything else on those bullet points? Touch is important, and those of us who have consent forms, we address that very formally, that whatever kind of touch might happen with us is agreed upon before the session, or making suggestions. If someone's going to bring a spouse or a family member, you can talk to them about what they might like, or, you know, if you have a spouse who gives someone a foot massage during part of that, can be a really amazing experience to have that touch. So I'll let Lisa add.
Well, one of the things that's, you know, it's funny because the music part is something that's so controversial and people feel very strongly about it. But really what is consistently my experience and the experience of other colleagues I've talked with, as well as in the research, is it really is, if you want the client to be, this has to be a corrective experience. You're facilitating a corrective experience of the client being able to have the support that they're wanting and needing. And when you think about trauma, trauma is trauma because you were threatened and, you know, perhaps actually not just threatened, but attacked in some way. And you didn't have the support that you needed to prevent the attack or to help soothe and comfort you after it. And this is the opposite. You want to facilitate the experience of the client having the support that they want and need to co-create that experience that they want to have, of being able to feel what they want to feel, so that they can actually have greater access to feeling what they want to feel outside of the ketamine treatment and outside of your therapy office. And the music can be such a beautiful resource that actually they can take it into the ketamine experience as a scaffolding for them to feel safe, because you want to emphasize this is supposed to be music that helps you feel and connect to the feeling that you want to have more often in your life. And so for some people, like the song that they would be listening to that would help them feel that, I would be like, there's no way I would feel that, would not be soothing, or that would be so, you know, disorienting. It's just not something that resonates. It has maybe a bad memory for me, but for them, it's helping them feel the way they want to feel more in their lives. And so it's perfect for them. And then what you're doing when they have had this experience with the ketamine and they've been listening to this music, and it's serving as a scaffolding when, you know, stuff that is scary, especially if you're not there, or especially if you're not sure how to guide, the music can be kind of their, they're tethered to safety. And then it also then reinforces to them when they listen to their music that they listen to in ketamine, and it was such a support to them, it can serve as, you know, some positive conditioning to help them when they have, it's a resource for them afterwards that they can listen to provide that centering, that comfort. And I encourage clients to look at their ketamine experience as something like, for instance, I have a lot of clients, they have not been able to feel relaxed in their body, like having the ketamine experience was the first time they even realized what relaxation is like. Why is music so controversial? Because it, in kind of historically with psychedelics, the way that they've been used is to have no lyrics, because they say the lyrics interferes and you shouldn't be guiding. You don't want to interfere. You just want to create the set and setting and allow whatever unfolds to unfold. That's one line of thinking. However, I actually take a much more directive approach, and my clients have, it's interesting because I'll always be attuning with them and saying, let me know if I'm not talking enough or if I'm talking too much. And, certainly some clients are like, no, that just let me be in this space. But the reality is most of them are like, no, keep talking, because I'm saying things that we have already gone over in terms of the things that they would want to be able to believe, the things that they want to be able to hear. So for instance, like saying things like, you're not alone, I'm here with you, you've got this, or, we map that out ahead of time. Or like, you are not your pain is another thing that seems to really resonate for people is, and like I also help them with their breathing to use their breath as a means of coming back, to a sense of feeling their own power in their lives and in their bodies, and helping them like, just take your breath and melt into this feeling. Just allow yourself to let go of anything that's no longer serving you. There's some key things that, again, I am preparing with the clients to know what it is that they want to be able to believe, what it is that they wish they could believe, and what things they would like to hear that they wish they could believe, that they would want me to say. And I make sure it's their languaging. It's very important. So as far as the note, why is music so controversial? It is because there's been a history of approaching psychedelics as we just need to have it be open-ended. We don't want to direct it. We want to be free-flowing and floaty. And that's, to me, that's got its place. And if that's what the client wants, by all means, that's what we would do. But I'm doing ketamine assisted therapy. I'm not just sending them off to a clinic by themselves,
And as we're training or hearing from different experts, you hear a wide variety on that. Even there's a married couple that works through MAPS, and the husband doesn't talk much at all, and the wife talks a lot. And you really, much like any therapy we do, finding your personal style and then what works with the client. And there is no shame, especially for those of us that are just beginning, even if you show up to a session, to sit there perfectly quiet for the whole 20 or 30 minutes that they're under the influence, and just being kind of there to watch them, and then just kind of checking in with them, after they're coming out of the drug. So again, a wide variety based on your experience, your training, your preferences, your clients' preferences.
And it is important to stay in alignment with what Kristan's describing, because if you're trying to go outside your comfort zone or be something other than what resonates for you, and it takes you outside of your centered space, that's the worst thing you can do, because the clients will pick up on it. And that's one thing that I've seen consistently emphasized, is that as a therapist, you want to be serving as a safe, centered, grounded person that's holding space. And so if you're trying to be, guiding it in a way that other people might, but it doesn't really resonate with you, that's going to feel weird, So you definitely want to just, whatever helps you to feel centered and grounded, stay attuned with the client, and allow things to unfold in that manner. But really, it's all centered around what is it that the client wants and needs in terms of support.
Yeah, I think EMDR is a good model, because we're kind of taught with EMDR, like, don't say anything. But I'm sure some of us who've been doing EMDR for a while kind of know when to insert and what to insert based on our intuition. So,
well, in EMDR, though, you have the resourcing in the future template.
Right.
And so I would say that actually, if you do EMDR, that's a really good resource and model for you to follow, and discuss that, though, with your client ahead of time. Some clients, again, they're going to want to have more space. Other clients are going to need more guiding and facilitation. I found that actually that there seems to be some kind of correlation between the level of trauma and the level of support in terms of guiding that people might need. But again, they might feel safer with their music lyrics and their music as being their fundamental, kind of their primary guide. And that maybe you talk with them and they decide, they will ask you if they need more talking, if they need you to say something. And if you come up with something that maybe resonates for them, about like just even a phrase that helps ground them, so that's really where you're in collaboration with your client to co-create this corrective experience.
Great.
So I have a question.
Yeah.
I have a client who, she hasn't started yet, but the reason I'm taking this class is she's going to do the ketamine clinic at the University of Utah. And I don't know if the U of U even has therapists in their clinic, or they just like do the ketamine, you sit there for an hour and then you leave. I don't expect you to know either, but I'm wondering, if I were to do ketamine assisted therapy, would it be she goes to the clinic, does the ketamine, and then someone drives her to my therapy office? Or like, what does it even look like?
Well, they could definitely drive her to your therapy office and you guys can have a session processing what her experience was. Just like if she had any experience that she was going to be auditioning for a play and she is anticipating some anxiety and it was something that was really pivotal for her and she wanted to go and process that with you afterwards. It's really a lot of asking questions of what came up for her. What was it like? What was helpful? And in what ways does she feel she would want support from you? Just the way you would process any other pivotal experience for her.
And understanding that, again, that can be very client-centered, because you can do ketamine-assisted therapy a day later or 2 days later. We often encourage people to journal that night, because you can forget, when it's real fresh, it's a good idea for them to write down what they got, but you could process it 3 days later or 4 days later. So it's really what timing kind of, and a lot of times this is scheduling between the client and the therapist. You can't be available exactly all the time. Maybe you can. I can't, but I'm just working out what works for the two of you.
I would recommend, though, calling the U and asking what their process is, and that way then you can even help, you're aware of what it is that they may be experiencing, and maybe even that could be something as far as preparation of, I don't know to what extent she's talked with them about what they do, but if they do have someone guiding, it'd be nice to know, what do they do? I'm not familiar, actually. Would they allow you to be present? I don't know. The other thing is, with Zoom, you can do really effective guiding and providing support even via Zoom, iPad or computer or even their phone. It could be on a little stand so you could see them. And just even, like I said, there could be just a couple phrases maybe that you see that, like, if they start to cry or you're just saying, just know that I'm here. You're not alone in this. You're doing so well. Stuff like that. Again, emphasizing the client-centeredness. What would feel supportive to this client to help facilitate the corrective experience they're desiring?
Great questions.
Yeah.
Thank you.
There is one more question that came up.
Insurance, right? And yes,
there's one above too about
the alcohol one.
Yes.
Is that what you're talking about, Laura?
Yes.
Okay.
There's actually really good apps for using ketamine to help with alcohol dependency. And keep in mind, the biggest difference, I know people will think, but it's a substance. Don't we want them to be completely sober? Well, again, it's about intentionality. And this ketamine and the other psychedelics, they can be used to disconnect or to connect. And it's really about the intention. Intentionality is vital. If you have someone that is using ketamine as a way of escaping rather than reprocessing and escaping pain without the intention of anchoring into resilience, that would be a concern. But as a therapist, then you're working with them it's part of their treatment plan, and it's helping them to be able to connect more deeply to access to their resources so they can employ them when they have triggers regarding the alcohol. And truly, the ketamine gives you an experience of recognizing, like, feeling more centered and whole, and knowing that it gives you a sense of being more connected to something larger. I would actually think that there should be something that says and they were saying this weekend, that you might want to have in your consent something that states that there's a risk that you might start believing in God. And if you don't want to believe in God, that, you just should be aware, because it does give you this sense of being connected to something greater, that you are greater than just your body, just your life experience here, and that you matter and you're part of a greater whole. With addiction in general, we know that it's usually some type of attachment injury, or that there's a trauma with regards to feeling that you are enough and that you're not alone. And so the ketamine helps a great deal to alleviate that anxiety of feeling that you don't matter, that you're not enough, and you're alone. And so that's why one of the reasons why it's so helpful in treating addiction.
Yeah. Oh, I had a thought, but then I lost it. It'll come back. I do see the insurance question. And in Utah, it's still not covered by insurance. There's a few psychiatrists I've heard that can bill it under other psychiatric codes, but most of the clinics we know, it's just cash at this point. Usually in Utah, you can get the 6 sessions for, on average, maybe about $2,000. Or, you know, a few clinics are a little more expensive. There's a few cheaper clinics, which is actually a pretty good deal. In California, it might be twice that. And when you think this can be very life-changing for people who've tried other things for a lot of years, it can be a very good investment.
And the cost of depression in terms of, you know, missing work, missing career opportunities, relationships, you know, the cost of depression are so high.
So, okay, so I'll go through these bullet points. We covered some of these already. So the 6 treatments over 2 to 3 weeks. We talked about IM and IV, nasal lozenges. And we do find that some clinics want or need boosters. I've heard clients describe it like, oh, in 2 or 3 months, I noticed myself start to dip down just a little bit and think, oh, maybe I need another ketamine treatment. It'll be a one-time thing at that point. You know, and that ratio, we have clients that never go back in again and are just fine. So often it might be a more severe client or someone who's still got some trauma to work through can go back in for additional treatment.
There's some people that have really severe PTSD and depression that will even go like once a month. And what I do with the clients is I'll have them schedule like a treatment for 1 month later if they feel that, you know, if it's something that's really severe. And then we try to stretch it out to where like the one after that, maybe it's 5 or 6 weeks, then 8 weeks. And what I'm doing is helping them with breath work, meditation, having a daily practice, as well as practices of implementing resources to help them, you know, if or when they get triggered, so that it's really, you're using the ketamine as scaffolding to help them access and implement their other resources. And so to whatever extent they're needing support with doing that, that would really be the indicator in terms of how frequently a booster would be needed.
And you think of one of the powerful outcomes from these drugs is neuroplasticity. So you think of those windows of neuroplasticity, especially 12 to 48 hours after the neuroplasticity is really quite strong. So what we're doing in between sessions is really important. You know, what practices they have, who are they going to be around, you know, what maybe life structure, whether it's a religion or a secular meditation group or something, that we're inputting lots of positive things. You know, it's not going to be a silver bullet if you don't have a lot of other good positive things going on in between, before and after treatment.
That is a really good point. And I think it is important to help them understand that, so that it's not that they think that they're, I mean, just whatever space they can create. And again, everyone has different life constraints, but to whatever extent they're able to take time to really implement their other resources and, you know, create like a kind of a retreat for themselves, that's really important. And it's actually 72 hours after the dosing that you continue to have rapid growth of the new neural pathways, and you're optimizing the neuroplasticity.
So you can get a lot of good things done in those 72 hours. So really, really good to think about. Like we said earlier, you know, some clinics will get people in and out in 60 minutes. It's nice to have longer, to clarify up front, how much time can I have in the room, whether it's the client themselves, like, can I lay there for 30 more minutes? You feel very relaxed after these treatments for the most part. So even if they're by themselves, it'd be good for them to understand how much time they have in the room, let alone
really important,
if you're going to be in doing more intervention. So really good to clarify. The under the influence part typically takes 20 to 40 minutes, that they'll be deep in and maybe not even coherent or speaking, and then you'll start seeing them come out of it.
I would actually say though, if they're only under 20 minutes, they need a booster. Like, you really want them to be in for the 40 minutes.
Longer. Yeah. So something to kind of watch. And again, very client-centered, like asking them afterwards, how was that experience? And working with the medical providers. Do we think we need to bump it up next time? And many medical providers will appreciate that feedback and will kind of work to adjust. Sometimes you want a lighter experience. Lisa does a lot of couples therapy, and you want a lighter dose if you want people talking and coherent. So when you're really getting into some of the therapeutic interventions, there's value at different doses and different intensities. So let's see. Yeah, the medical providers do an intake before treatment, and they'll do vital checks. Most of the time they should be checking blood pressure and other things to make sure the client is okay. And we talked about scheduling the treatment room. So before sessions, you know, we've touched on some of these, just like you would do any of your good therapy work. You know, what's the topic and focus of therapy? What are basic themes we want to work on? What are key traumas that we need to work on or are still working on? Setting an intention for a psychedelic experience is important, and not to say it'll always go that way, but often if you can help your client kind of really set that intention, that can kind of guide how that experience will, or impact how that experience will go for them. Is there any specific targets you're hoping to process either during, or 1 day after, 2 days after, 3 days after, in that window of neuroplasticity? We've talked about music, identifying resilience points, resources, positive relationships, positive experiences. It's good for the client to go in with some coping skills, whether it's a breathing exercise. I had a colleague who did an experience and it went kind of dark for them, but he was able to draw. He's a real kind of positive self-taught, positive thinker. That's been one of his strong coping skills during his life. And he was able to tap into that to kind of pull himself out of a pretty dark place that he went during his ketamine treatment. So kind of talking to them explicitly about some things they could do or think about to help resource them before, during, and after the experience. And again, being calm before the treatment. If you go into a ketamine treatment in a frenzy, you know, you may not have as good of an experience as if you had some time to meditate, relax, drink a cup of tea before you can't drink because you have to fast for, what is it?
Well, they have some water.
A little bit of water.
Yeah.
So anyway, do things so that you're going.
I'd say like 3 hours before not to eat anything.
Okay.
If you had like a piece of fruit, that would be okay.
Wouldn't be the end of. There is some nausea, but the provider sometimes
they can give
the
you,
providers have medication that they can do that helps with the. Yeah. So, and then as we said before, encouraging them to journal afterwards so they don't lose, all the good stuff that came up during the experience. So I see another question here. Is there a benefit to doing the initial 6 sessions over 2 to 3 weeks? Wondering about us as therapists who are considering experiencing it. Would we need to do all 6 sessions to have the benefit? That's a good question.
I'd say if you don't have depression, anxiety, PTSD, something that you feel is blocking you from kind of living your best life, then you really could try it once and see. But if you do have some history of depression and some things where, frankly, you've been working really hard and you work really hard to implement your resources, the 6 is really, what I've seen is the 6 is really important for people who are addressing specific trauma patterning and depression and anxiety, because those first couple of sessions, even like the first 4, can be bringing up stuff that, we'd love it if people would be able to experience it after all the sessions, they felt great. That's really not what happens. It's really what in my experience, people were, and this actually is shown in the research, is that it kind of goes ebbs and flows in terms of those first 4 sessions, because you're bringing up stuff that they're needing to process. So for some people, it's great. For other people, they can get a little bit discouraged and feel even a little bit depressed. They could feel tired. And it's important to help them to know that that's part of this process. But by the end of it, they're going to feel good. And those last 2 sessions of the 6 are often, they're the ones that you're really reinforcing positive things that have come up, you're really reinforcing and just the access to the resources, the positive images, the positive feelings, and really dialing that in so they have strong access to it. Whereas the first 4 are you're really processing the trauma. So I think it's really important that you do the 6 for anyone that, including yourself, if you're really working through some specific issues.
And that said, just to use myself as an example, I've done a lot of my work and was in a pretty good place. And I think I've done 3 over the space of a year. And that's been personally and professionally valuable to me in that I was kind of more in stuck grooves, and it kind of got me unstuck on some things and kind of new possibilities. And again, you know, I think when you've done a lot of work, your odds of having a very positive, lovely experience go up. And
true.
so I had some very positive, lovely experiences and that really benefit me in being able to understand what my clients may go through, or at least to know what it feels like on the other side. So
I think that's 100% like the best advice. And as far as the 2 to 3 weeks, if people are able to schedule it where it's twice a week with at least 1 day in between, that's going to be optimal. But again, you have schedule constraints for people. So if they're needing to do it like every other day for 2 weeks, because they can take 2 weeks off of work, for instance, and that's when they want to do it, then that's great. There are actually, I've just been made aware with a client that I'm working with, they found some, I think it's called Mind Bloom, that they're doing now, like weekend intensives where it's like you go on a Friday, Saturday, and Sunday, and you do that 2 weekends in a row. That I don't think is optimal, but again, they're dealing with scheduling constraints for people. Keep in mind, you have that 72-hour window of where you're continuing to have this neuroplasticity, and you're having all of these new neural pathways that are growing. And so if you can have the 72 hours in between to be journaling, to be engaging in other of your resources and really creating a full experience, then that's fantastic. But if you don't have the luxury of that for whatever reason, and you're then, you know, there's these other options. Now, if it's not something that's imminent trauma, but it's more that, you know, they're functioning well, you can do once a week for 6 weeks as well. So that's another option.
So that, you know, that 2 to 3 weeks is kind of the studied protocol, but there can be a wide variety of, you know, beyond the studied protocol. So, yeah. All right, therapy follow-up after session. So again, for any of us, whether we have no training or a lot of training, you know, great to ask what came up for them. And it's, you know, I've had some clients just have some really amazing, beautiful experiences that are just wonderful to talk about and process in therapy. Definitely ask them if there was anything wrong with the setting, the mood, you know, anything at the clinic that you could advocate for them for, like if they kicked them out of the room really quick, you know, can we help either encourage them to ask the clinic if they can have more time? So really helping, again, advocate for them and optimize their experiences. And then just like any good therapy that we do, noting key themes, images, traumas, resources. You know, I think I shared with this one client, some really great parts came up that we've been able to use over and over again as resources in therapy. You know, that's gold. This is good material that's coming up. And then definitely note any unprocessed or open targets that you can keep working with and helping them, you know, continue to process those things and then strengthen and resource positive experiences. So we're doing good. I think we're going to get through these slides. We've talked quite a bit about this topic and what to do during the session. And again, we highly recommend, if you really want to get into this and do real active intervention, that you pursue psychedelic assisted therapy trainings. We'll show you a couple on our resource slide, but there's all kinds of stuff. I'm sure you're seeing it, whether it's a, you know, online, I did a 12-hour online, you know, webinar through MAPS that was really amazing and very, very cheap, you know, so there's a ton of info out on this right now. Again, there's lots of different protocols and opinions. So you might hear one thing from one trainer and then hear the opposite from someone else, and just understand, you know, this isn't necessarily a new field, because this has been being done under the table for a long time, and, you know, above board more recently. So just, you know, kind of keep that open mind, and, you know, maybe get training from different people to get different perspectives.
Well, I think it's important to recognize, look at therapy itself.
Right, good point.
You know, there's things like, I am such a strong believer in emotionally focused therapy. There's some people that would never, ever want to practice that way. And it's not a good fit for their personality. They don't like having all that emotion in the room. Ketamine is no different, that there's different styles of therapists, and there's different models, and it's finding the right fit for the therapist and the client.
Great. I see a question there. I'll finish these bullet points while I have Lisa read that question, and then I'll let her address that. Lower doses we talked about. If you're going to want more talking, there's doses where it can just feel like you're having a great massage, you know, where you don't leave the room at all or leave your body. So again, different doses for different purposes. We can do couples therapy. There's some great body work things that can be done. You know, if we've agreed upon and talked about and have a body work provider that we want to bring in, that can really facilitate some great experiences. And therapists, there's some appropriate touch that therapists can learn in different trainings, and again, when agreed upon with your client. And remembering that the client is neurologically very susceptible and vulnerable during this time. They use these same drugs to, you know, MK Ultra, and to brainwash people. So what happens during that time, that there's this open neuroplasticity, is really important, and we don't want to exploit that or take advantage of that. And we want to be really careful with what we're doing to not introduce either negative material or material that we didn't kind of have consent for and agree on. So,
you know, that being said, if you do hypnotherapy, or if the client has a guided meditation that really resonates for them and helps them feel centered and grounded and whole, those can be really good options to pair with ketamine. So can I take that question?
Mm-hmm.
She says, I've got a client who did a ketamine session, and she came in euphoric 4 days after it. They told her to come back in 6 weeks for her next ketamine session. Is this a different type of treatment, more for treatment-resistant depression? It doesn't seem like what she did is planned to be paired with therapy. Again, she went to a clinic, so it wasn't with a therapist. You're her therapist. They're not providing the therapy, they're providing the ketamine. And if she wanted you to be there with her the next time, you totally could. As far as, you know, I need to know, like, what is her intention? Like, why did she end up going to ketamine? Is it that she's wanting to deal with, like, just had a rut she was trying to get out of and wanted a breakthrough, like what Kristan was talking about, more of like a performance enhancing or just a, you know, growth experience? If she has severe depression, the reality is she doesn't have to. Nobody has to do it according to the research protocols. If she's finding a good result after doing one, and she's doing therapy, she wants to schedule it in 6 weeks, I would say just, you know, see how it goes for her. I'm not really sure. I mean, she's happy with it. I think it just goes in line with what we're talking about, having it be client-centered and recognizing that there are a lot of different ways that people are administering the ketamine.
Great. So Kate Kincaid, I think that's how you say your name, says that she's in the CIIS training. That's the same one Lisa's doing.
Oh, no, it's actually, I'm doing a different one.
Oh, okay,
Yeah,
sorry. So feel free to connect
yeah.
with Kate if you have questions about that one.
Yeah.
Here are our resources, and then we'll have a few minutes left for questions, which is great. So this is the booklet that I mentioned. That's just a real basic, pretty medically focused, which is great because we often don't know the medical part as much. So there's a lot of really good medical information in there. And then we put Lisa's information because she is available as a consultant for any of you who might want to book more time with her, pick her brain, you know, do some formal consultation. So there's her email. They're asking Kate to put your email in the chat if you could do that. I kind of threw some of these in here on the end so we can send out more information. So Scepter, if you haven't heard of them, is the local organization that did their first conference a year ago.
Yeah, almost a year and a half now.
Yeah, it was right. It was in January, right before the pandemic hit. And that's Parth Gandhi, who runs a ketamine clinic here in Salt Lake. And I can't remember his colleague. If you Google SCPTR, I hope I spelled it right, I'll check it real quick. You can find their website, and they offer trainings that are for all kinds of people, not just mental health professionals, people who want to be guides or medical people. It's a very broad training with a lot of readings and some writing and group projects and stuff. I'll let Lisa talk about her certification that she's doing for a minute.
Well, it's Integrative Psychiatric Institute. Anyways, I've just been really impressed because they have Gabor Mate, Pat Ogden, Michael Pollan, Richard Schwartz, and like a whole other list of people that are just really the experts in the field of trauma, and they're available to, they share their presentation, but then they're available for questions and answers. And then it's similar to CI, the California Institute of Integral Studies, in that it goes for a year, and then you do, you participate as, a participant for the guided ketamine experience. One of the things that's different with CIS, or the California Institute of Integral Studies, you have to sign saying that you will not participate in anything underground, like you can't go to any ayahuasca journeys or take anything else unless it's prescribed ketamine or prescribed, medical marijuana card. The Integrated Psychiatric Institute doesn't have those restrictions, and people are talking more openly about their experiences. A lot of the people have gone to ayahuasca journeys and are still active in, and exploring the different psychedelics. So that is one difference of those two programs, but they're very similar. And I would just strongly recommend anyone who's interested to participate at whatever level of training that you're interested in. There's lots of good stuff going on. It's a great time to be a therapist, really interesting.
I'll stop sharing the screen right now and I'm going to Google some of this information that people are asking for, but we've got about 5 minutes left for questions and discussion. So let's hear what you have to say.
And if anyone would be brave enough to show your video, I would love to see their faces.
Lisa, do you want, while we're waiting for questions, to Google the website for your training and put it in the, maybe on my computer so we can just cut and paste it?
Sure.
I have a question as far as recommendations you guys would make regarding the experiences you've had with clients. Given that there's different times during the treatment that you could be providing therapy, right, whether it was before, during, after, do you see a correlation or a benefit to the types of themes that you're treating and when you provide the therapy session, right? Like if it was specifically for trauma or depression, is there a therapy timed that is, better for one, or that you would encourage your client if schedule permits?
I'll answer while Lisa's Googling, and I, have less experience than Lisa does. What I found with most kind of general clients, maybe not a really severe, severely suicidal or severely dissociative client, is that usually if we get to it within the week, we're going to be just fine. As far as different types of clients, I look at everyone from a trauma perspective, so I don't think, oh, this person has depression and this person has trauma. I think they both probably have at least some attachment or historical material that's playing into their symptoms. So I kind of look at them the same. So that's my limited experience, but I'll let Lisa speak to it.
Well, and I apologize. I'm going to need a little bit. I heard the first part, not the other, because I was trying to find this website for you guys. But to speak to like timing after in terms of processing, I believe that well, in my experience, the sooner that you're able to process after the session, the better. If you can schedule, like before I had at my agency, before we had practitioners, I was referring people to go to do ketamine experiences, but I was preparing them, and I feel like you can prepare them. It doesn't matter. That could be a week before their session, but the sooner that you can process after their experience, whether it's like right after their experience or the next day or a couple hours after, the sooner that you can, the more fresh the experience will be. But I would tell them, please journal right after, and the bullet points of things that you want to process with me. It just has to be more fresh the sooner that you're processing with them. And I will say that people have consistently, before I had it in my agency where I was doing, it on site. Definitely the therapists, the clients were saying it was such a better experience when they had the preparation and the integration. When they didn't have that, it was a lot harder. And that the integration that they would have after, one of the sessions, it was an integration, but also a preparation for the next session. And that they would often take in the themes that we were processing, working on. They would draw upon that as a resource for scaffolding for themselves during the sessions. And those are sessions that I haven't been guiding yet. That was prior to me having any experience guiding. So there's a lot of great work you can do by just providing support in terms of preparation and then integration, even if you're not present. And what was the other one that you were talking about, that you don't make a distinction?
If there's different
themes?
diagnoses, is there a timing for the follow-up that's
I don't see it as being that. I really am in the same mindset as you are. And really that is where people who are more steeped in neuroscience are really going more towards recognizing that what we're looking at as diagnoses really are the ways in which people's traumas are manifesting through symptoms, but that it's really that there's a root cause of some form of trauma, something that activated the neurophysiology and the belief system to respond and form really beliefs that we are alone, we're not enough, we're basically our life's in danger, we're not safe. And even though we could say, well, your life isn't in danger when you have a rupture in a relationship, as mammals, that is encoded in our DNA as a risk to our survival. So to understand that we're always talking about a lack of safety when we're talking about trauma and emotional dysregulation. And so creating that safety and creating access for clients to be able to find grounding and finding that safety inside, their minds, their hearts, their bodies, is really going to be the overarching goal, regardless of diagnosis or symptomology.
Thanks, Lisa. Our time is officially over, so we want to formally thank all of you. I think we can stay around for 5 more minutes or so if people have more questions, but we want to formally thank all of you for attending. Laura put her email address in the chat there for those of you who want the CEUs. And again, we really appreciate your interest and support of TICN and our programming, so thank you. And now we'll just kind of chit chat for a few more minutes for anyone who wants to hang around. Do you have anything to add, Laura?
Oh, yes, actually, if any, would you, Kristan and Lisa, be willing to share the PowerPoint? I don't know if anyone's interested in that.
Yeah, definitely.
Okay, I can just send that to everyone who bought a ticket. And then if anyone is also interested in the recording, you could include that in your email and I can send it to you. Or I can include that. I'll include the recording and the slides in an email to everyone. How about that?
Great.
I am developing a mentoring apprenticeship too. If people are interested, if you wanted to participate in observing me guiding, then me doing some co-guiding, and then me supervising you guiding. That's the way that I'm going to start helping people to be able to learn how I'm guiding, especially if you're wanting to work with couples or with sexuality. That's something that I'm looking forward to sharing that with people, with other therapists. I'll be starting that in October.
Other thoughts or questions? great to see
Lisa,
your. Go ahead.
Lisa, will that be in Arizona or Salt Lake?
This
Your
is
apprenticeship?
it's Salt Lake. Yeah.
Cool.
Yeah.
Wonderful presentation.
Thank you. Thanks, Claire Julian. Good to see you.
You too.
Really exciting stuff happening. I think those of us who have tapped into this already are just tapping into it. You know, it's happening and it's really accelerating. So it's pretty exciting times for, you know, therapy and medical interventions. I know a lot of psychiatrists feel very rejuvenated in their careers. Like we've got something now that, you know, they can even kind of get more involved in healing rather than just coping or, you know, medicating. So it's pretty exciting times. The doctors we're working with started with us. They went out and got training and then used our clinic as a guinea pig. And it's neat to see how exciting it is for the doctors as they're wrapping their heads around it and getting comfortable with it and seeing the change that it can make in people's lives. It's pretty exciting. So.
Well, and one thing, I'm actually not taking any new clients, but what I'm doing is facilitating concierge integrated retreats for people and helping therapists who want to refer their clients to me to facilitate those 6 ketamine sessions. That I'll do that. I want to have time to prepare with them and then, you know, do the 6 sessions. But really, it's the goal of helping their therapist be able to well, just deepen and augment their work. And I'm integrating, you know, different healing modalities like the breath work. I have colleagues that are yoga instructors, massage therapists, nutritionists, just a holistic team, basically, that if people are interested in having an integrated experience for a week or for 2 weeks, if they're doing the ketamine, it would be 2 weeks. And then the days that they're not doing the ketamine would be out in nature, would be, they'd be meeting with these other treatment providers, integrating with their therapist that's doing the ongoing treatment. So that is something that's a resource to you if any of you have, you know, patients, clients that would be interested in something like that. And then that also would be a nice way of facilitating, mentoring therapists that are interested in this work, is that they could be part of that preparation, witnessing the ketamine sessions and the integration, and then they can, you know, take the baton from there and continue their work.
Okay, just one more minute. Maybe any last final questions before we sign out? Okay. All right. Thank you so much, everyone. Great to see you. Reach out if
Nice
you
to meet
have
you.
more questions. So thanks a lot. Thanks,
Bye.
Laura.
Thank you.
Bye-bye.